I think that that's a critical point here. Who benefits from the Louisiana Medical Malpractice Act as it exists right now? It's clear. Medical conglomerates, huge corporations, insurance companies, and private equity companies that are now taking over a whole bunch of different types of care, including nursing homes in Louisiana. What they're looking at is if we save dimes on the front end, then we might have to pay pennies on the back end. That type of simple math decreases the quality of care, it removes accountability, and it hurts the people of Louisiana.
Welcome to Bayou Justice, Breaking Victims, Protecting Power. I'm your host, Chip Wagar, a medical malpractice attorney dedicated to reforming Louisiana's healthcare laws. On this show, we dive deep into the challenges faced by patients in our state, exploring how current laws often favor institutions over individuals. Each episode will bring you compelling stories from victims, insights from legal experts, and perspectives from lawmakers. Join us as we work to shed light on these issues and push for meaningful change in the Bayou State.
Hello, everybody. I'm Chip Wagar, and I'm here today with T.C. Wicker. We're both with the Patient Rights Advocacy Forum, whose mission it is to change the law here in Louisiana to reflect modern-day realities and to correct the injustice that is visited on medical malpractice victims in the state. This is our program, Bayou Justice, Breaking Victims and Protecting Power, because that's what our law does at the moment. It breaks victims and protects powers, and we want to do something about that. Today, we're going to start off with a discussion about a recent letter to the editor
a guest column.
Yes, that needs a little debunking. And if you didn't catch it, it was in the NOLA.com or the Advocate. It's a letter by Andre Como, an insurance broker in Lafayette, Louisiana, who is suggesting some more tort reform and having to do with fixing automobile insurance. Now, you might say, well, what does that have to do with medical malpractice? The reason is he wants auto insurance to follow the brilliant example of medical malpractice, and he goes on to extol how wonderful and brilliantly the medical malpractice laws of Louisiana have served the citizens here with some, shall we say, inaccurate facts.
Yeah. So the first thing is that Mr. Como is just flat wrong about a statement regarding the Louisiana medical malpractice cap. He says that the cap allows unlimited economic damages. Well, that's incorrect, Chip. That is actually factually wrong. We have a case, and I'm sure you've experienced this type of issue, where the primary breadwinner for a family dies at a young age, and that family gets $500,000. There are no economic damages under the Louisiana Medical Malpractice Act. The only exception is past and future medical bills. So this family is left out in the cold because the primary breadwinner for the family died on an operating table. There aren't any past or future medical bills, and he has passed away. They've suffered the worst loss possible. And Louisiana law says $500,000 is the most that they can recover. That's number one. Number two, Mr. Como has two specific factual inaccuracies here. First of all, he talks about how the insurance premiums for doctors have been helped. Well, you and I both know that that is factually incorrect.
That is totally false, actually. That is completely false.
In 1975, Louisiana's doctors ranked 25th in the nation for insurance premiums. Where are we now, Chip?
Top tier among the most expensive states for healthcare providers buying medical malpractice insurance today. Louisiana's right up there with New York, Illinois, Florida, and the most expensive markets in the United States. And we're one of the smaller states, but Louisiana's medical malpractice insurance premiums are among the most expensive in the country. So we've gone from middle of the pack, 25th out of 50, to top tier.
And so something else that Mr. Como doesn't even look into, doesn't even address, is the fact that we've taken away the people's rights in the state of Louisiana. And even he doesn't try to argue that any sort of savings have been passed along to the people whose rights have been taken away. Patients don't save any money. Healthcare expenses continue to balloon. Healthcare insurance costs for the average citizen in Louisiana, any cap has not affected those insurance costs. So people have their rights being taken away. But then on the other hand, people don't gain anything from it. And I don't think it takes a genius to figure out that it's certainly not true that Louisiana has upper echelon medical care within the state also.
No, that's true. Louisiana's medical industry here in this state is among the lowest and the worst in the country. There's a rating system that the Federal Centers for Medicare and Medicaid Services, the CMS, uses to rate nursing homes in the country. We have the worst. We're number one. We're the absolute worst in quality of care for nursing homes. Similarly, hospitals, patient safety in hospitals here with these very, very low caps that we have dating from 1975. Let's see. TC, were you born in 19? Were
was
you alive?
Not even a twinkle in my dad's eye.
Not even a twinkle.
I was not born. So the cap's been in existence for 50 years and not a single adjustment has been made.
Isn't that amazing? I don't know who would want to be paid a salary in 1975 dollars today. Probably nobody could survive. I looked up something that you might find this interesting. What do you think the cost of a 1975 Mustang coupe would have been in 1975?
All right. So with the caveat that we just acknowledged,
you weren't even born.
I was not around. I would bet $12,000.
You'd be very high. It was $3,850, $3,850
Wow.
in 1975. Yet, trivia, who was president in 1975?
Was it Jimmy Carter?
No.
Really? Was it Nixon?
No. Gerald Ford.
Gerald Ford.
Gerald Ford, yes. He was president in 1975. Many of our viewers probably didn't know that there was a president named Gerald Ford, but there was. He followed Richard Nixon. That's how long ago we're talking about that Louisiana's medical malpractice cap has not kept up with the times. And one of the things our organization's trying to do, would like to do, is introduce a bill in the legislature next year to deal with that. Why don't you tell them what we're trying to do?
Yeah, so it's interesting to discuss what we're trying to do in light of this op-ed, this guest column, because it's relatively straightforward. First of all, the $500,000 cap needs to be updated. There's no doubt about that.
It was thought to be fair in 1975,
and we know it to not be fair in 2025. Then beyond that, we need to do away with the medical review panel system. What the panel system actually does is it increases the number of claims total while hurting those who have viable claims. Individuals who have faced medical malpractice have to spend time in a multi-year process before they can even file a lawsuit. That also means, Chip, that if a claim is frivolous, it takes the defense multiple years before they actually get to address the merits of the claim. So it works both ways. It creates a system where the hospitals, doctors are spending more on their defenses because there are more claims. It only costs $100 to levy a medical review panel complaint, but it also hurts those victims who have actually faced medical review panels. Some states have taken an alternative approach. And that's at the very beginning of filing a lawsuit, that an affidavit by a credentialed physician is signed, and that affidavit attests that there is medical malpractice. PRAF, we want to do away with frivolous claims. It hurts everybody when there is a frivolous claim. And when you talk about actually ensuring that we do away with frivolous claims, the affidavit system is much more efficient, and it's actually much more effective.
And actually, although we're not primarily engaged in saving insurance companies bacon, but the truth is it actually saves them a lot of money that causes premiums to be so expensive.
Correct. And then beyond that, when we talk about the cap being raised, Mr. Como talked about how economic damages are included in the cap. And we know that that is factually untrue, but they should be. And that's, I think, something that everybody can agree to. Or at least it seems that, the leader of a leader of the insurance industry certainly believes that that should be the case. That a family that has been hurt by losing their primary breadwinner shouldn't face that injury year after year. That they should be able to be made whole. Justice should be able to be delivered when you talk about that fact.
And guess who does pick up the tab for that loss of the primary breadwinner in a family, be it the mother, be it the father, or whoever it may be? Once that person dies or is disabled through a catastrophic injury that they can't work anymore, what do you think happens? Social Security, you pay for it. I pay for it. We all pay for it. The taxpayer pays for someone now who's disabled and can't work. Which makes more sense? The wrongdoer who's responsible and their insurance company paying for it, or all the rest of us paying for it while the person who did this medical malpractice, walks away after paying their $100,000 and gone on to the next?
I think that that's a critical point here. Who benefits from the Louisiana Medical Malpractice Act as it exists right now? It's clear. Medical conglomerates, huge corporations, insurance companies, and private equity companies that are now taking on over a whole bunch of different types of care, including nursing homes in Louisiana. What they're looking at is, if we save dimes on the front end, then we might have to pay pennies on the back end. That type of simple math decreases the quality of care, it removes accountability, and it hurts the people of Louisiana.
That's a great point, TC. And I'll make another one. Back in 1975, there was a lot more, shall we say, independent practitioners practicing medicine. Doctors with their own offices and their own practices were the prevalent mode of practice. That's not the case today.
No.
Today, you have a system in Louisiana, Ochsner Medical Center, the Ochsner Foundation employs close to half the doctors in this state. They own 30 or 40 hospitals. I don't know. I've lost count. Same with LCMC. They own dozens of hospitals. The independent practitioner no longer is paying for medical malpractice premiums. These gigantic, huge medical conglomerates, I guess is the best word, are the ones that are actually providing the medical malpractice coverage. And when we say huge, I'm talking, in the case of Ochsner, for example, we're talking about a $4 billion company. a $4 billion company whose executives, because they're always very fond of talking about how greedy we are. We're greedy trial lawyers, right? We're greedy. Take a look sometime at the executive pay salary of these massive medical institutions. Now, we're talking millions of dollars a year in salary for their top executives. One top executive who recently retired from Oxford was making $9 million a year. When you talk about greed, take a look. Don't take my word for it. Look it up yourself. These are the companies that are benefiting by the system as it is now. And they would begrudge our clients, medical malpractice victims with terrible catastrophic injuries and death, they would begrudge them full and fair compensation for those injuries. Well, I think we've debunked this mythological exposition that we saw in the NOLA.com. But let me just close with this. If you want to do something about this, because God forbid you are a victim of medical malpractice, and it's not as rare as you think. Medical malpractice is the third leading cause of death in the United States. You have a 1 in 10 chance every time you walk in the hospital being injured in the hospital, not for what you went in for, but being injured when you walk into the hospital. So it's definitely a possibility that you or someone you know will suffer from medical malpractice. Before they do, let's do something about this horrible law that we have now in Louisiana. Check out our website. It's Patient Rights LA like Louisiana.com. Go to the page that says, what can you do? And you will find a list of your legislators by where you live. You can easily find out who your legislator is, what their email is, how to contact them. Write them, contact them, talk to them if you know them, and tell them it's time. It's time to stop the gaslighting. It's time to cut the myths. It's time to do something to reform Louisiana's medical malpractice laws and bring it up to date. Thanks for listening. We'll talk to you again soon.
Thank you for listening to Bayou Justice. I hope today's episode has given you valuable insights into the complexities of medical malpractice in Louisiana. If you'd like to learn more about our mission or get involved in our advocacy efforts, please visit patientrightsla.com. Your support can make a real difference in the lives of patients across our state. Remember, together we can create a fairer, more just healthcare system for all Louisianians. This is Chip Wagar, and I'll see you next time on Bayou Justice.